Welcome to UMCC Medical Consultant Connector, your trusted source for clear and reliable health information. Today, let's answer a common question that many of us have when faced with a persistent cough or cough medicines, specifically antitussives, safe to use, and more importantly, when are they the right choice for you? Antitussives, also known as cough suppressants, are medicines specifically designed to reduce the urge to cough. They work differently than other types of cough remedies. They achieve this by calming the brain's cough center, essentially dialing down the signal that triggers the coughing reflex. They're best suited for dry, non-productive coughs that don't bring up mucus. Think of those tickly, irritating coughs that keep you up at night, preventing you from getting the rest you need. Suppressing a productive, chesty cough isn't helpful, and can even be detrimental, since your body needs to clear mucus and irritants from your airways to facilitate healing. So, before reaching for a remedy at the pharmacy or in your medicine cabinet, take a moment to identify your cough type. Understanding the nature of your cough is the first step. Dry, irritating coughs stemming from colds, allergies, or exposure to environmental irritants may benefit most from antitussives, giving your body a break from constant coughing and helping you rest and recover more effectively. For coughs with phlegm, expectorants are a better choice. They work by helping to thin the mucus, making it easier for you to clear it out through coughing. The key takeaway here: use antitussives only for dry coughs that serve no real purpose except to make you feel miserable and disrupt your daily life. Used correctly and appropriately, they can effectively break the cycle of irritation and ultimately help you recover more quickly and comfortably. Next, let's delve deeper and see how these medicines actually work within your body to suppress that cough. So, you're wondering how these cough suppressants actually work? Let's break down exactly how antitussives work within your body to alleviate that persistent cough. We'll explore the journey these medications take and the impact they have on your system. After you swallow a syrup or pill containing the cough suppressant, it's absorbed into your bloodstream, beginning its journey throughout your body. From there, it travels to and is processed by your liver. The liver breaks down the medicine, metabolizing it into a form that your body can use effectively. This process is crucial for controlling how long and how strongly the medication works within your system. Because of this metabolic process, always follow dosage instructions carefully to ensure safety and effectiveness. Most antitussives target the brain's cough center, which is responsible for triggering the cough reflex. By acting on this center, they make it less sensitive to triggers originating from your throat and lungs. This action effectively reduces your urge to cough, providing much-needed relief. This happens even if the underlying irritation or inflammation is still present. However, some antitussives take a different approach and work directly in the airways. They achieve this by numbing the nerves that are responsible for sending cough signals to the brain. These peripherally acting medicines essentially stop the time to cough message at its source. This prevents the signal from ever reaching your brain and triggering a cough. So, whether they're calming the brain's cough center or numbing the airway nerves, the ultimate goal remains the same: to provide relief from that constant, disruptive coughing. It's important to remember that these medicines don't cure the underlying cause of your cough. Instead, they just help you rest and recover more comfortably while your body heals. Now, with a better understanding of how they work, let's take a closer look at some common antitussives and explore their potential interactions. You'll see several antitussive ingredients on medicine boxes. Dextromethorphan, DM or DXM, is the most common, found in many over-the-counter formulas. Codeine, a prescription opioid, is stronger, but carries more risks, including dependence. Benzonatate, also prescription only, numbs airway nerves and must be swallowed whole. Each works differently, so ask your doctor or pharmacist which is safest for you. Be aware of drug interactions. Dextromethorphan can dangerously interact with MAOI antidepressants and codeine with alcohol or sedatives. Combining codeine with other opioids or anxiety meds can slow breathing dangerously. Always tell your healthcare provider about all medicines and supplements you take. Being informed helps you use these medicines safely. Antitussives, like all medications, can cause side effects in some individuals. It's crucial to be aware of these potential effects so you know what to watch for and how to react. Dextromethorphan, a common ingredient, may cause dizziness in some people. Other possible side effects include drowsiness or feelings of nausea. Remember that taking high doses can be particularly dangerous and should be avoided. Codeine, another type of antitussive, carries its own set of risks, including constipation, drowsiness, and the potential for addiction with prolonged or excessive use. Benzonatate, available in capsule form, can sometimes cause headaches or a temporary numb mouth if the capsule is chewed or broken. Therefore, it's crucial to swallow it whole and never break the capsule. It's important to seek immediate medical help for any severe reactions, such as a skin rash, difficulty breathing, or sudden confusion. Furthermore, some people should avoid antitussives altogether, particularly those with underlying respiratory conditions like asthma or COPD, pre-existing liver problems, or known allergies to any of the ingredients in the medication. Children are considered especially vulnerable to the side effects of these medications, and for good reason. Codeine is generally not recommended for kids under 12 due to safety concerns, and dextromethorphan is usually avoided in very young children due to the risk of adverse reactions. Therefore, it's vital to always carefully check age restrictions on the packaging and consult with a pediatrician before giving any cough medicine to a child, ensuring it's both safe and appropriate. Ultimately, it's best to use these medicines only when they are truly needed to alleviate symptoms, and always strictly as directed by a healthcare professional. Next, we'll discuss considerations for pregnancy and some final important safety tips to keep in mind. During pregnancy, always consult your doctor before taking any antitussive. Dextromethorphan appears relatively safe, but use only if necessary and under medical advice. Codeine is generally not recommended, especially late in pregnancy, due to risks for the baby. Benzonatate safety in pregnancy isn't well known, so avoid unless prescribed. Try non-drug remedies first: humidifiers, warm drinks, or lozenges. In summary, antitussives can be safe for dry coughs if used correctly and by the right person. Always follow dosing instructions, watch for side effects, and ask your pharmacist or doctor if unsure. If your cough is severe, lasts over a week, or comes with fever or shortness of breath, see a doctor. Thanks for watching UMCC Medical Consultant Connector. Stay informed and take care.